Let's talk about why a chiropractor should pay attention to this in 2023. There is tremendous neurological input from the heart back up to the brain through the vagus nerve. So the vagus nerve is a big, big deal in calming the brain and reducing inflammation. Now, the electrical field of the heart itself is something like 50 times that of the brain. So it really sets the electrical field for the entire body. They have instruments that can measure the electrical field of the heart multiple feet away from the body. The heart makes some of its own neurotransmitters and hormones, and the pulsations of the heart influence the cerebral spinal fluid flow. And so in our viewpoint, the heart isn't just a pump for blood, it's all these other things as well. In 2022, we got a heart sound recorder, which is a microphone that listens to the heart valves, not so much the actual sound, but the movement of the heart valves, more like a seismograph, where it's measuring movement that's transmitted through the chest wall. And we can gain a lot of information on what we need to do structurally to help the person and what we need to do nutritionally to help the person. And you know, we've all had this virus thing in the last couple years, and so that's made paying attention to the heart really, really important. What I want to share with you today is how we work with that from a mechanical, fascial, neurological point of view. And that is that we have to pay attention, if we're going to be balanced in our autonomic nervous system, we have to pay attention to all this input that comes from our gut and from our chest back to our brain. And so one of the ways that we do that is we keep in mind that this heart doesn't just float in our chest. The heart attaches into the diaphragm here through ligamentous attachments. The heart has ligamentous attachments that go from the second to the fourth thoracic spine and even into the lower cervical spine, C6 and C7. Then the heart has ligaments, they're called sternopericardial ligaments, that go from the pericardium, or the sac that surrounds the heart, to the upper part of the sternum, and then again to the lower part of the sternum. So as we work with a person to get all this freed up, and again, we've seen that through the heart sound recorder, the body simply will not accept the nutrition that's best for the heart, the supplements that we use, if the heart is not mechanically, fascially, and neurologically free. And so when we're working with this, we keep in mind a three-way dance, that if we release the diaphragm, then we also need to release the sternum. A lot of times we find torque in there where the sternum, upper sternum goes one way, the lower sternum goes another way. How do we work with that? We use an instrument, goes in there and just taps gently. And then we have to release the thoracic spine. So the diaphragm, the sternum, the thoracic spine. It's the three-way dance of the heart. It helps our heart have the mechanical freedom it needs. It helps it have the visceral, the fascial connections that pull all through the connective tissue of the body. And it helps have the right neurological input, not only within the heart, but through the autonomic nervous system, the vagus nerve, back to the brain. It's a big, big deal. We pay attention to it. That's why we get, one of the many, many reasons we get amazing results, and people travel hours and hours to see us. I'm Dr. Michael Winters, Winters Wellness, Chiropractic Redefined.